Hi, I'm Paul Schocken, the ultrasound director at St. Mary's Hospital in Livonia. Today we're going to be doing a quick introduction to using the ultrasound machine to initiate a patient exam and going over some brief knobology. We've had questions over the past several months on how to do this and issues with saving images properly to QPath, so hopefully this will be helpful. So now let's direct our attention over to the ultrasound machine. When you first open the lid of the machine or turn on the machine, it will be on the patient information page. The on button to get to that page is right here. Now, if for any reason, when you approach the machine, you see the scanning screen with images that will pop up here from another provider's study, that likely means that they forgot to end their exam. What you do at that point is press this end button right here. If that doesn't bring you back to the patient screen, you click number 1 where it says patient, and now you will be on the screen. Now here, the first step is to enter in the patient and provider information. The patient ID goes in this field. You can use the barcode scanner to enter in this patient information. You'll see when you have a patient sticker that there is a barcode and also a QR code. This barcode will make the patient's CSN populate into that field. This will make the MRN populate into that field. Although using either one is acceptable, it is preferable to use the MRN as it makes looking up the patient information easier in the future. What you'll see me do now is scan the patient MRN, and you could look at the screen to see what happens. So you see that the number popped up here in the patient ID field. Note, you do not have to select this field for this to happen. No matter where the cursor is on the screen, it will automatically go into that field when using the Mindray. The next step is to put in the provider information. All the providers should have a QR code. If you do not have a QR code, please contact me and I will print one out for you. When you scan the QR code, your username, which is the same username from Epic, goes into the appropriate field. Please note that for residents, PAs, and med students, they will go into the operator field. Attendings will go into the diagnostician field. This will just change the field where your name appears in QPath from operator to attending. Only one attending at any given time could be in this diagnostician field. If you're scanning multiple operators who are not attendings, you can scan each QR code one after another, and they will populate in this operator field. You also have the option of manually inputting this information. To do that, you click on the field, and let's say there's a second attending who wants to add their name on. They have to put their name in the operator field, not the diagnostician field. What you would do is separate each user ID by a comma and no space and type in the name. When you scan the barcodes, please look to make sure that the correct information populated. This is important. Once you are satisfied with this page, you use the trackball to move the cursor over to the button that says OK. On either side of the cursor, on either side of the trackball, there is a button. Either one of these buttons could be used to click. When you click the OK button, you go to the scanning page. From here, the next step is to select the exam type. Number 2 here has a button labeled probe/exam. When you click this button, this page populates. When you get to this page, you need to select the appropriate exam type under the transducer that you're using. Right here we have the linear or vascular probe, the cardiac or phased array probe, and the curvilinear or abdominal probe. If I'm doing a fast exam using the curvilinear probe, I highlight fast and I select it. Now you can see that in here it says fast exam, and this is the ID for the probe that was selected. You can also see that the patient's CSN and operator names populate up here. If there's only an attending, the diagnostician will not populate here, so don't be scared if you don't see it. Once you're ready to scan, one other thing you can do is use the button in front here to raise and lower the height of the machine so that you're comfortable. Once you're set up by the patient, the next step is to make sure that you have the appropriate depth. That is step 3 labeled here. You'll notice that on the machine, there are depth markers. Each of these hash marks is 1 centimeter. You will also see every 5 centimeters is labeled 5, 10, 15, 20. If you press the down button, you go deeper. And you could see it goes deeper 1 centimeter at a time. Now we're at 25 centimeters. If I press the up button, I decrease the depth. Now we're at 10 centimeters. You want to make sure to have the minimum depth you need to still see the structure and slightly beyond. If you have too much depth, what you're looking at will appear very small, and it will be difficult to identify pathology. Step 4 often could be skipped. This is the focus position. This is rarely used, but an option to know about. The focus refers to this green arrow here. If you are at greater depths, especially using the vascular probe, and the structure is deeper down, you can use these arrows to move the green arrow or focus down to the structure you're looking at. This narrows the sound waves onto that structure and helps optimize the image. When you're ready to save an image or a clip, we have these 2 buttons right here. This one is labeled still image. If you press still image, it saves one image that you're looking at. And you could see that a thumbnail populated up here. If you want to save a clip, you press prospective clip. And you can see that it's telling you it's saving 1 of 4, 2 of 4, 3 of 4 seconds, and so forth. When it's saved, the clip populates right here. Sometimes when you're saving a still image, it will be helpful to freeze the image before saving it. If you press this button here, what you see on the screen will freeze, and then you can make any necessary measurements and save the image. The other function of this freeze button could come in helpful. If you see something while you're scanning, for example, the common bile duct, and then it comes out of view, if you press the freeze button, you can use the trackball to move back several seconds to look at images that were recently seen on the screen. Once you see the image that you're looking for, you can either save that image or make any necessary measurements. To unfreeze the image and resume scanning, you can click the freeze button again, or you can click B. This stands for brightness mode or B mode and is the standard scanning mode that we use. While you're scanning, sometimes it might be necessary to adjust how bright or dark the images look. This is called the gain. You can rotate this knob to make the images look brighter or darker on the screen. This adjusts the overall gain. Rarely, it might be necessary to adjust the gain at different intervals. These knobs right here adjust the gain from the top of the screen, the middle of the screen, and bottom of the screen. Typically, you do not need to adjust these settings. Sometimes you will see that the image looks very dark or very bright in some parts of the screen. It might be that the user before you put these buttons all the way to one side. If that's the case, you can just line them up in the middle, and that should be adequate for our purposes. One of the other functions that we commonly use is color flow. If you press the C button or color flow, you will see this green box appear on the screen. You can use the trackball to move it around. This, just like it sounds, is used to identify color flow within a vessel or structure. For example, if you're looking at an abscess, to see if there's any vessels there. If you're looking at a lymph node to identify that that's a lymph node versus a non-vascular structure, you can use this. If you press either of the click buttons, you will note that this turns into a dotted line. When it turns into a dotted line, you can again use the trackball to adjust the size of the box by moving it left to right and up down. You want to have it as small as possible to still cover the structure that you're looking at. When you're done adjusting the size, if you press click again, it turns back into a solid line, and you can again move the box around on the screen. When you are in the color flow setting, if you turn the gain knob, this will actually adjust the sensitivity of the color flow. If you turn this up, you could see even right now, without us scanning a patient, you see lots of artifact. If you're scanning a patient and you see too much color flow or too much artifact, you can turn down the gain. So you can adjust the gain up and down to optimize that setting. When you're done using color flow, you can either save a still image or a clip with a color flow. Typically, clips are more helpful in this case. When you want to resume normal scanning, you can again click B mode or brightness mode to go to the normal scanning mode. Another helpful function is called M mode. If you press the M mode button, you will see this line drop down on the screen. The two most common things we use this for are for identifying the presence or absence of a pneumothorax and for measuring fetal heart rate. That will be discussed separately. But with using M mode, once this line is in the middle of the screen, you can move the trackball to move this line left and right to center it over the structure, whether it be the middle of the pleura or the heart. If you press M mode again, you will get a waveform. When you're ready, you can freeze it and either make any necessary measurements or just save the image. And another thumbnail will pop up when it's saved. Again, clicking on B mode will go back to normal scanning mode. The last function that we're going to talk about is pulse wave Doppler. Sometimes, especially with vascular access, it could be tricky identifying a vein from an artery. If you come across this situation, this could be very helpful. If you press this button, you will see that there's a line with a gate on the screen. If you move this gate to the blood vessel of interest and press pulse wave Doppler again, just like we do for M mode, you will start to get a waveform. And you should hear a whooshing sound right now on the screen. If there is an artery, you will see an arterial waveform with up and down spikes. If it's a vein, you will see a constant small venous waveform. I will post pictures of that separately. Going back to B mode goes back to normal scanning mode. Now, one more thing to talk about is making measurements. For example, if you want to measure the size of the aorta, the size of the gallbladder wall, what you would need to do is press freeze once you have the object you want in view, and you press the caliper button. When you press caliper, you see the set of calipers pop up. I move this around to where I want it, I click, and then a second one appears to make the second measurement. Once I have it where I want it, I click again, and I could see that the measurement popped up here. If I want a second measurement, all I have to do is move the trackball and another caliper appears, and I do the same thing. If I want to save that, I press save, still image. Now note that there is also a measure setting on the machine that will also generate a caliper. Unless you're doing an actual calculation, like fetal heart rate or bladder volume, try to avoid pressing the measure button because it will cause labels on the screen that often are not the labels that we're looking for. If we're simply measuring a distance, then caliper should be adequate. Again, this could be saved, and if you want to resume scanning, you go back to B mode. When you're done scanning, if you want, you can optionally review the thumbnails. If you press this cursor button, the cursor will appear on the screen. And you can go through and review any of your images or clips. You even have the option of deleting them. When you select a thumbnail, there's a trash can in the corner, and you could delete it from the study right here. And then I get a prompt and I say, okay. When I'm done scanning, I have to remember to press the End Exam button. When I press End Exam, I get a prompt confirming that I'm sure that I want to end it, and I click Yes. At this point, the image is automatically being transmitted to QPath, and we go back to the patient screen here. Now, you're ready to start over again and scan the next patient. Now, there is one more scenario to be aware of. Sometimes, if there's a priority 1 or a trauma patient and you need to scan the patient right away, we don't have a patient sticker or barcode ready yet. However, if I try to start scanning and press OK, you will see that I get a prompt saying that a patient ID is mandatory. In order to bypass the screen, I can either hit the Escape button or I can hit this Cancel button. If I do that, I am able to start scanning, I'm able to select my exam type, and go through the same process we just did. Typically, during the course, while you're still in the patient room, registration is able to bring in the barcodes and the wristbands. What you can do at that point is use your barcode scanner, and right from the screen, you can focus on the screen. Right from the screen, you can go ahead and scan the patient barcode. It's trying to scan. And it'll generate at the top. You might get a prompt asking you whether or not you want to update the exam with this information. You can then also scan your user ID, and you get a prompt on the screen saying, do you want to append the exam or replace it? I click append. And now the patient information and provider information is labeled. If you're unsure, you have the option of going back to the patient screen, and you will see that it is populated here. And at this point, you have your images saved already, so then you could go ahead and end the exam, and it will upload the images to QPath. If you click End the Exam without saving the patient or provider information, the images will still go into QPath, but under a generic study with no name. This could later be updated within QPath, and we will have a separate QPath tutorial describing that. Now, when you're done, avoid closing the lid of the machine or turning the machine off, because that will halt the transmission of images to QPath. It is okay to leave it open and turned on for the next provider. When you're done with the machine, please return it and plug it in. Now, a few general reminders with using the machine. First, we have wipes on the back of the machine that you can use to clean the probes. Currently, we have pink top wipes. In the past, we had gray top wipes. Whichever wipes are on the machine are the only ones that are safe to use with the machine. If there's any question, please feel free to contact me. We also notice on the machine we have a box of non-sterile probe covers. Whenever you're doing any sort of exam where you might be contacting bodily fluid, please place the probe cover over the exam. So if you're doing peripheral vascular access, if you're doing incision and drainage, or if you're looking at anything that has a lot of discharge, please go ahead and use the cover. These fit very nicely over the linear probe. You could probably make them fit over the curvilinear probe if you try hard enough. The last thing we're going to talk about is probe placement. Please make sure to put the probes back in the proper location. You can see that the linear probe is on the far right of the machine. Please put it in the right probe holder. The reason for that is when we swap sides, the cords begin to get tangled up, and it could damage the fibers within the cables. Make sure the probes are in the holders, and you can put the cords on the hooks. If the cords are on the ground, we run the risk of running them over with the wheels. So we keep them on the hooks. That is all we have for this tutorial. If you have any questions, please contact me. Thank you.